On this episode, we'll talk about chemotherapy after your gastric sleeve. We'll talk about night sweats after your surgery. And we'll talk about hormone replacement therapy after your gastric sleeve. Hello everyone and welcome to episode 20 of the AskDrA show. I'm excited to be here. We've had many questions and excited because of the response you guys have given me. So don't forget to use the hashtag AskDrA for us to pick up those questions. If you have submitted your questions, I will require you to be a little patient because not every question makes it to the following show, but we have them lined up and they will make it to the show sooner or later. All right, let's jump into the questions then.
Chemo is causing havoc on my sleeve. I have gastritis and it's tough. Any tips with breast cancer and sleeve?
All right, so first of all, I'm sorry to hear about the diagnosis of the breast cancer. I've had quite a few patients that after your sleeve, down the road, years down the road, they have lymphoma, breast cancer, prostate cancer, renal cancer, etc. So yes, chemotherapy with the sleeve or without the sleeve is very aggressive on the body. It will cause gastritis. So in patients, like in your case, it is mandatory you take antacids or a PPI, a proton pump inhibitor, constantly, day and night, all right? Morning and evening, 20/20. We were talking about Nexium the other day. We were talking about omeprazole. You can use those medications. It is good to protect your sleeve because otherwise, if you don't, well, you know what I'm talking about. The gastritis and chemotherapy patients is very aggressive, and you need to settle your sleeve down and be well regarding your sleeve. So, number one is take your antacid. Make sure everything is you're putting your sleeve nice and calm, or at least the most possible. If you are dealing with a lot of nausea, make sure your doctor is giving you or you're taking your anti-nausea medication like Sofran, ondansetron, because that medication helps very well eliminating or blocking the nausea. And that prevents the vomiting, and that prevents irritating of the sleeve, and that prevents your sleeve being upset. All right, so my best advice is stick to your doctor. Make sure your doctor knows about this, and make sure you're taking your antacid.
Is it normal to sweat so much at night while sleeping?
Is it normal to have night sweats after surgery? The answer is no. It is not normal. I would dig into what is going on. There are several reasons for having night sweats, or the famous night sweats. Sometimes it's a hormonal disbalance there or unbalance there. Sometimes it's a symptom of something else. Sometimes it can be it can be as simple as having too much coffee throughout the day, or some other habit that you picked up, or a energy drink that you're now taking in the evening, and it's causing the night sweats. So you need to analyze what is going on. Take-home message here is the night sweats are not related to the sleeve. The night sweats are not normal, and the night sweats need to be followed up with your doctor.
I am on hormonal injections and I am worried that I will be able to continue it after my sleeve, or will have to stop it. Any recommendation?
All right, so hormone injections or hormonal therapy or a replacement therapy, do you need to interrupt it because of the surgery? No. Do you need to wait after your sleeve? No. Do you need to do anything special because of your sleeve, or you're headed or you're scheduled with your sleeve? No. Do you need to do anything special with this hormonal therapy right after your sleeve because you're recovering from your sleeve? The answer is no. So the best advice is work with your doctor, let your surgeon know about this, let your endocrinologist know about this, or your primary health physician know about this, and continue taking your medications unless stated by your doctor. So there you have it. That's it for episode 20 of the Ask Dr. A show. Don't forget to subscribe to Bings, all right? To the channel. Bing here, bing, bing here, bing. All right, so there you have it. Just click on the buttons. It'll take you to the subscription. That way you won't miss any other episode of the Ask Dr. A show. Question of the episode is, do you or have you ever experienced night sweats before or after your surgery? All right. Question is yes, no, down below on the comments section. I'm looking forward to hearing from you. That's it for episode 2020 of the Ask Dr. A show. I'm Dr. Alvarez from Endobariatric.com. We'll see you in the next episode.